Hello everyone, this is Rajendra Mughal. Today we are going to discuss regarding the next topic in rheology, that is thixotropy, measurement of the thixotropy, then antithixotropy or negative thixotropy, and rheopexy. Okay, so before actually going in detail about your today's lecture, I just remind you that is we have conducted two lectures in rheology previous to this. In first lecture we have discussed regarding the introduction, then definition, importance, the units of rheology and viscosity. In second lecture we have discussed regarding the various types of the flow, okay, Newtonian, non-Newtonian, in that plastic, pseudoplastic and your dilatant. Okay, so this classification, the examples and mechanisms are very important from the competitive exam point of view. So see all the two lectures. Now let us start with your today's lecture. So content of my today's presentation, that is, first of all we will discuss regarding the thixotropy. Again, thixotropy, it is very important point in rheology. So in that we will discuss regarding the definition, mechanism, measurement, and lastly it is your applications. Next it is your concept of the bulge and the spur. Next point, antithixotropy and negative thixotropy. In that again, definition, mechanism and examples, and lastly the Rheopexy or Rheopecty. At the end of this lecture we will discuss regarding the comparison between the thixotropy, antithixotropy, and dilatancy and Rheopexy. Okay, so let us start. So first, thixotropy. If the rate of shear is increases and after achieving the desired value then decreases, it is assumed that the downward curve should be identical with and superimposable on the up curve. Okay, so suppose say for example, if you are increasing, in case of your Newtonian system, if you are increasing the rate of shear, like suppose if I have conducted this example, I have given this example, that is, suppose say rate of shear per second, it is given. So 50, 100, 150, 200 and 250. Suppose this is the rate of shear. Suppose if you increases the rate of shear and after achieving the this particular rate of shear, suppose say 250, again if you decreases, okay, so it is expected that your viscosity it should be remain same. Okay, so that is your curve, that is a downward curve would be identical with and superimposable on the up curve. But this is true for the Newtonian fluids only. Okay, so this is true in case of your Newtonian system, while in case of your non-Newtonian system, this is the curve, it may be shifted towards the right hand side or it may be shifted towards the left hand side. That we are going to discuss in later section. So suppose I take the example of your Newtonian system. The rate of shear, it is given per second 50 to 250, and viscosity in centipoise in ascending order. Okay, so as the rate of shear it is increases, the viscosity it will be decreases. Okay, in case of your Newtonian system. And suppose say at 250 the viscosity it is a 50 centipoise, and after achieving this particular rate of shear, suppose again if you decreases in the same order, if the rate of shear it is decreases in the same order, then you can see that is the viscosity again it is decreases in descending order, it is 50, 200, 325, 425 and your 500. Now compare the viscosity between ascending order and descending order. You can see that is here the viscosity it is remains same. So your up curve, that is in ascending order, and second your down curve, that is in the descending order, the viscosity it is the same. That's why they will superimpose over each other and they are identical. Okay, so this situation it is only valid for the it is only valid for the Newtonian system. Okay, for shear thinning system, the downward curve it is frequently displaced to the left of the up curve. Okay, so shear thinning system means that is your pseudoplastic system. Okay, so in case of your pseudoplastic system, this down curve it is frequently it is shifted towards the, you can say it is the left side of the up curve. Now what is the reason and all that we are going to discuss in subsequent sections. The consistency of the material on the downward curve it is less than the up curve at any one rate of shear. So shear thinning system, already we know that is a shear thinning means the consistency it is decreases. Okay, so in thixotropy again the consistency on the downward curve it is further it is decreases. So that's why again in up curve the viscosity it is decreases, but again in the downward curve the viscosity it is further it is decreases. That's why the consistency on the downward curve it is, you can say that is a, it is comparatively compared to the up curve at any point it is less than the up curve. The lower consistency on the downward curve indicates that the structural breakdown occurs when the material is sheared and it does not reform immediately when stress is removed or reduced. Okay, so what is the why this particular it is happen, that is in downward curve the consistency why it is decreases. The reason it is given, that is when you increases the rate of shear, then in that case the structural breakdown it is occurs, and this structural breakdown it is not able to reform immediately. Okay, so that's why the consistency on the downward curve it is always it is less. Okay, so like see, take the say a simple example. It is a very easy to break anything. So accidentally suppose if you break anything, so it requires some microseconds or seconds, but again to join that particular element to that particular anything material, again it is a time consuming process. Similarly in case of your thixotropy, if you increase the rate of shear, the structural breakdown it will be immediately, it is instantaneous, and but the for the reformation of your structure it is a time consuming process. Okay, so now let us discuss regarding the mechanism. First of all, the definition is an isothermal and comparatively slow recovery on standing of a material of a consistency lost through shearing. This is the exact definition, but you can remember in another way, that is suppose that you have the material in simplified ways, that is you have the material, the consistency of the material is lost after shearing. Okay, and this consistency it is lost through lost by shearing, and it is at the isothermal means that is at the constant temperature. Okay, so we have the material, we increases the rate of shear, after that after achieving the desired value, again if you kept aside, allow it to settle down at the rest position, then the consistency on the upon resting it is, you can say that is it is a low, that is a comparatively slow recovery. What is the meaning of this? That is a comparatively slow recovery. So on downward curve the recovery it is very slow compared to the up curve. So in up curve the breakdown of the structure it is very fast, while in case of your downward curve the slow recovery it is there. And if your material it is exhibiting such kind of your properties, such material it is called as the having the thixotropic behavior. Okay, so that as per the definition, the thixotropy can be applied only to shear thinning system. Here the example it is given, that is suppose a pseudoplastic system, I can take the same rate of shear per second, suppose a 50 to 250, and viscosity if you see the in ascending order it is 500, 425, 325, 200, and finally it is your 50. So it is expected that if you again decrease the rate of shear in the same order, the viscosity should be identical. But here you can see that is a viscosity in centipoise in descending order if you compare between the ascending and descending. So at 250 rate of shear, last column, see the last column, at a rate of shear 250, viscosity is a 50 and 50, it is the same, that is here at the equilibrium condition. At 200 rate of shear, viscosity in ascending it is a 200, while in case of your descending it is decreases to 175. So difference it is 25 centipoise. Similarly at 125 it is a, instead of in ascending order it is 325, and in descending order it is your 300. At 100 it is 425 and 400, and at 50 rate of shear it is 500 in ascending order, and in descending order it is your 475. So if you compare, then in that case in descending order the viscosity it is less than the ascending order. What exactly it indicates? That is the viscosity or the consistency on the downward curve it is decreases. So likewise such kind of your observation we are getting in case of your thixotropy. Here the curve it is showing, that is your for plastic system and pseudoplastic system. Take the example of your pseudoplastic system, that is your up curve, that is it is started at the origin, just goes on increasing the rate of shear after achieving the desired value at the equilibrium, again decrease it, so your curve it will be shifted towards the left hand side. This is your up curve, it is denoted by red color arrow. So up curve, and after that the down curve. You can easily see that is your down curve, it is shifted towards the left hand side. Now the mechanism, what is the possible mechanism for thixotropy? Thixotropic system usually contains asymmetric particle and they attach to each other by numerous point of contacts throughout the sample. Okay, so in thixotropic material, that is the particles, there is a these particles are aggregated to the each other, they adhere to the each other, and this adherence, the point of contact, it is a multiple. Okay, it is denoted in this particular diagram. That is the first. See the first right hand side, the upper diagram, you can see that is a particle, there is an aggregation of the particles. The above arrangement gives some rigidity to the system and it resembles to the gel. Okay, so such kind of your system, that is when there is a aggregation, the particles aggregations are there, so such kind of your system, it offers the more resistance. Okay, so higher the resistance, so that's why it is called as the having the higher consistency, and that's why the system, it is said to be behave like a gel. Okay, resemble like a gel. When shear is applied and the flow starts, the above structure begins to break down due to the loss of contact and particles becomes aligned. Okay, so now what will happen, that is if you on application, that is you can see that is on shear, the contact break down. Okay, so the individual particles get separated, there is no point of contact between the particles, and such kind of your structure, obviously it will offer the less resistance. Less resistance means that is having the low viscosity, so viscosity it will be decreases. Okay, this is on shearing. Now what will happen, that is if you after this, if you keep your material at the rest, kept aside, then what will happen, that we are going to discuss. On removal of the stress, the structure starts to reform, but the process, it is not instantaneous. Okay, so upon removal of the stress, what will happen, that is again these particles, they will start collision between the particles, it will occur, and after that again the aggregation between the particles, it will start. But it is a time dependent process, it is a time consuming process, it is not the instantaneous process. That's why you can say that is in first step, that is a gel to sol, that is it is a instantaneous process. The breakdown of the particle, it is rapidly it will occur, while in case of your to convert your sol to the gel, again it is not the instantaneous process, it is a time dependent process. Now what is the mechanism for that? The possible reason for the slow recovery is the asymmetric particle come into the contact with one another by undergoing the random Brownian motion. So random Brownian motions, it means that it is also called as a zigzag motion or randomness of your molecules. So at the below of this slide, it is a diagram, it is given, that is the particle, it can move in any direction, and in such random movement, due to such kind of your random movement, the collision between the particles, it will occur. Okay, so if the collision between the particles, it is a frequent, then the recovery, it is also very fast, and if the collision between the particles, if it is a slow, then in that case the recovery, it will be it can be extended. So likewise this mechanism, it is totally depends on the Brownian motion. Thus the rheogram is highly depends on the rate at which the shear is increased or decreased, and the duration for which the sample is subjected to any one rate of shear. So now this rheogram in the thixotropy, it is depends on the two parameter. First, it is the rate at which the shear is increases or decreases. Okay, so suppose say for you have the same example. Okay, suppose say sodium alginate in water, you have this particular sample. If you increase the rate of shear, suppose say 10, 20, 30, 40 and 50. Okay, and now after achieving the 50 value, again if you decreases in the same order, that is again 40, 30, 20 and 10. Okay, and in another, that is your in another case, suppose if you take the example, that is your instead of same sample, sodium alginate sample, if you subjected for the another rate of shear, suppose say 100, 200, 300, 400 and 500, and again in descending order, again 500, 400, 300, 200 and 100. So obviously that is in first case the rate of shear is very small, that's why the structural breakdown will be less, there will be low thixotropic behavior. so recovery will be fast. In second case, that is the rate of shear, it is a higher, that is 100 to 500 instead of 100 to instead of your 100, it is in the second case it is 100 to 500, and in first case it is only 10 to 50. So obviously at the higher rate of shear, the more structural breakdown it will occur, and more structural breakdown means again the recovery, for the recovery it will take the more time. So this is the first factor, that is rate of shear. If you change the increase or decrease the rate of shear, and second it is your the time, okay, duration, the duration for which the sample it is subjected. So suppose say we will take again the same example, that is a sodium alginate. Sodium alginate, suppose the sample it is subjected, suppose say for 5 minutes, okay. So for 5 minutes, again the same sample it is subjected for suppose say 30 minutes. So what will happen, that is for 5 minutes the sample it is subjected for 5 minutes, obviously less structural breakdown it will occur compared to when the sample it is subjected for the 30 minutes. The time it is increases, more and more structural breakdown it will occur, and the sample it will shows the more thixotropic behavior, and more time it will be required for the recovery. Okay, so these are the two factors, and these two factors also same it is used for the measurement of the thixotropy, that is the time, and second it is a different rate of shear. Okay, so this question it was asked in your GPAT, that is if the consistency of your material it is depends on rate of shear and the duration, that such kind of your phenomenon it is called as, okay, Rheopexy, thixotropy, negative thixotropy, dilatancy. So if the consistency of your material it depends on the both the parameters, that is the rate at which it is increases and decreases, and second is your duration, then the answer will be it is your thixotropy. The mechanism it is shown, that is at the rest multi-point contacts are there, so it is your system it is behave like a gel. After that on shear the contacts break down, so system it is converted from the gel to sol. In sol state you can see that is the individual particles are there, they are completely separated from each other, there is no point of contact. After that when if you set aside, then particles contacts are re-established due to the Brownian motion. Again your system revert back from the sol to the gel, again particle contact again are re-established, and your system it is converted to the gel state. So the simple transition of your thixotropy, that is a gel sol gel, it is called as the thixotropy. Now how to measure the thixotropy? Two methods are there. First it is your by determining the structural breakdown with time at the constant rate of shear. So the constant rate of shear, suppose say 100, 200, 300, 400 and 500, but the time it will be different. One sample it may be suppose it is subjected for T1, and another sample suppose it is subjected to T2. So let us take example, that is 5 minutes and 30 minutes. Okay. So the up and the down curve will form the hysteresis loop depending upon the area between these two curve, the thixotropy behavior it will be measured. Okay, suppose if you started the hysteresis loop. What do you mean by hysteresis loop? Suppose see the point A, this point A on your diagram. So if you increases the rate of shear, this is your up curve, and after achieving suppose say point B, this is a suppose a rate of shear at point B, suppose if you achieved completely, and after that if you decreases the rate of shear in the same order, then the down curve we are getting, that is a B and E. Okay, B, this is your downward curve, and AB it is your up curve. The area within the up curve and down curve it is called as the hysteresis loop, and the area within the hysteresis loop define the degree of thixotropy. Okay, so higher the area under the hysteresis loop, higher the thixotropic behavior. Okay, so the shear rate is increased at a constant rate up to the point B, and then suppose it is a decrease at the same rate up to the point A, then you are getting the rheogram, that is ABE. You can see in this particular diagram the area under this particular curve it is comparatively it is small. If the shear rate it is maintained at the point B for time t1 seconds, and then it is decrease, then you are getting the ABCE rheogram. Okay, so if you again started with the point A, go to the point B, this is your up curve. At point B, suppose it is held for t1 time, then the rate of shear it will be remains constant, so it will goes to the point C. the shearing stress it will be decreases, rate of shear it will remains constant, and after that again, suppose after 5 minutes, for example, suppose say convert it into the seconds, so again if you decreases the value, then downward curve, that is a CE, you will obtain. Okay, so now you see the area under this curve, that is A, B, C and E. Compared to the first curve, that is the ABE, this curve, the area under the hysteresis loop, now it is increases, means the thixotropic behavior it is increases. Similarly, if the rate of shear maintained for the T2 seconds, then curve, that is a A, B, C, D, E rheogram it is obtained. Okay, instead of your T1, suppose if you held for the T2 time, then you are getting the rheogram, that is A, B, C, D and your E, and the area under the hysteresis loop, now you can see it is the highest in this particular diagram. So as the sample it is shared for the more duration, more time, the thixotropic behavior it will be increases. This is the first method for determination of your thixotropy. The thixotropic coefficient it can be determined by using the equation, that is the B is equals to, capital B is equals to U1 minus U2. So we have taken the example of your plastic system, that's why we U1 and U2 are the plastic viscosity divided by natural log of in brackets T1, not T1, it is a T2 upon T1. Okay, so the thixotropic coefficient it can be given by equation, that is B is equals to U1 minus U2 divided by natural log in brackets T2 upon T1, where U1 and U2 are the plastic viscosity of two downward curve, and T1 and T2 are the time intervals. This is first method. Similarly, second method, determine the structural breakdown due to increasing rate of shear. So in first method, the rate of shear it was constant. Rate of shear we are keeping constant, and we are changing the time. But in this case, we are changing the rate of shear. For example, suppose the sample it is subjected, suppose say at different rate of shear, suppose say 10, then 20, 30, 40 and 50. This is the one set. After 50 again it is decreases to 10. After in second case, suppose the same sample it is suppose say 10, then 50, then suppose say 100, then 150, 200 and 250. Again from 250 again decreases to 10. So likewise again in second case, obviously if you increases the rate of shear, then more structural breakdown it will occur, and your sample it will shows the more thixotropic behavior. So system is subjected to the different rate of shear, like suppose say V1 and V2, then two hysteresis loop is obtained. Okay, so again we are taken the example of your plastic system. So first hysteresis loop it is quite small, that is the slope of this, the coefficient it is given by 1 upon U1, while the hysteresis loop under the second curve it is that is V2, it is quite big. Okay, so it is denoted as 1 upon U2. So what is the conclusion from this particular both the methods? That is if the duration or if it is increases, or the rate of shear if it is increases, then more structural breakdown it will takes place, and more structural breakdown means that is again the time required for the recovery it will be increases. Okay, so that's why your sample it will shows the more thixotropic behavior. The thixotropic behavior by this second method it can be determined by the equation, that is capital M is equals to 2 in brackets U1 minus U2 divided by natural log of V2 upon V1. So in this equation same, U1 and U2 are the plastic viscosity, and V1 and V2 are the different rate of shear. What are the application? Very important point, applications. So first, it is a greater the thixotropy, higher the physical stability of dispersion systems. Okay, so as you know, that is as per the Stokes law of sedimentation, the rate of sedimentation of the particle is inversely proportional to viscosity of dispersion medium. This is the Stokes law of sedimentation of your dispersion system. So rate of sedimentation, that is denoted by capital V is equals to d square in bracket rho minus rho 0 into g divided by 18 eta 0. So in this equation, d it is the diameter of the particle, rho it is the density of dispersed phase, rho 0 it is the density of the dispersion medium, g it is the acceleration due to gravity, and eta 0 it is the viscosity of dispersion medium. So you can see from this particular equation, that is rate of sedimentation, it is inversely proportional to the viscosity. What exactly it gives the importance? So as what is your conclusion? That is if the viscosity, if it is increases, then rate of sedimentation of your particle, it will be decreases. Okay, so likewise, by consideration of your thixotropy, how we can increase the stability and increase the patient compliance, that we are going to discuss. That is, at the rest, due to the gel state, that is a high consistency, the system has the higher viscosity, and therefore rate of sedimentation of your particle will be low. So as the at the rest position, before agitation, before the application of your any kind of your stress, your system, it is behave like a gel. Gel means it is having the high consistency. High consistency means high viscosity. So as the viscosity it is a higher, rate of sedimentation of your particle will be less. That is shown in diagram. That is see the first diagram on left hand side. At the rest, gel, high consistency. Okay, and aggregation of your particle, it is also there. Second, that is on shear, the consistency lost and the dispersion becomes pourable. So on shear, what will happen? That is, it is gel, it is converted to the sole. See the second diagram, that is your on shear, sole in brackets, low consistency, that is consistency, it is a decreases, particles get separated from the each other. Now the system, it is, you can say it is a converted to the it is converted to the sole, and it is a pourable. Now what is the importance? So if it is a sample, it is a highly viscous, then sometimes it is quite difficult to pour that particular you can say it is a product from the container into the vessel. Okay, although your product is a very good, having the good physical stability, it is also rate of sedimentation of your particle also less due to the higher viscosity, but at the same time you have to keep in mind that is it should be pourable. Okay, pourable means transfer of your product from the container into the vessel. Like suppose if you are taking the different tonics, the cup syrups, okay, so we are taking 5 ml or 10 ml of your product or cup syrup or the tonic from the bottle. So if it is having the very high viscosity, then it can, in that case it is a quite difficult for the patient or for the consumer. So that's why the viscosity during the administration, it should be decreases, and during the stability, during the whenever it is not used, it should maintain the proper integrity and the increase the stability. So when it is kept aside, it becomes the gel. See the third last diagram, that is when it is kept aside, again it is revert back to gel, having the high consistency, again aggregation of your particulate will occur. And so in general, what is the application of your thixotropy to increase the stability? So when the product it is not in use, the viscosity it is higher, it is behave like a gel, so rate of sedimentation of your particle will be very less. When when you want to take the that particular medicine, okay, that particular suppose say cup syrup, okay, cup syrup if you want to take, so the direction it is always given on on this particular bottle, that is shake well before use. So this particular by shaking the bottle, we are applying the certain amount of your force, and that much force it is sufficient to break the contact between the particle and decrease the viscosity. So after the mild shaking, so your consistency will be decreases, and after that it can be pourable into the vessel. Again, suppose if you take the 5 ml of your medicine, you close the properly that particular container, again keep it. Now the dose it is directly to the next day. So during this particular 24 hours, again the product again revert back to its gel state and maintain the physical stability. The rate of sedimentation of your particle should be less. That is called as the ideal thixotropic material. Okay, ideal thixotropic product. So whenever it is required, you have to just agitate the bottle, take the medicine, and after that, before the taking and after the taking, the product it is present in the gel state, so that's why it maintain the proper physical stability. So likewise, by using the thixotropy concept, we can increase the stability of your product, and at the same time also increases the patient acceptability. Okay, so that by applying the thixotropic, the physical stability of your dispersion can be increased. Second application, it is again very important, that is a degree of your thixotropy. Now depending upon the degree of thixotropy, again degree of thixotropy, the you can say you can apply for the injection of procaine penicillin. Let us see the example. There is a parenteral suspension of the procaine penicillin containing 40 to 70% weight by volume have the higher thixotropy. Okay, the percentage you have to remember, that is 40 to 70% weight by volume have the higher thixotropic behavior. While injecting, the structure of the suspended particles break down so that the product pass through the syringe. So again, these are the sequences that will occurs while injecting any kind of a product to the patient. So first it is at the rest, when the product it is in the bottle, so it is present in the gel state. So if it is present in the gel state, so that's why rate of sedimentation will be less. So this is at the rest, high consistency. So while filling into the, see the second diagram, that is while filling into the syringe. So when you apply the pressure by using the plunger into the syringe, then your product it will pass through the needle. Okay, and when it is a pass from the needle, then due to the friction with the needle, the consistency of your material it will be decreases, that is having the low consistency. Now your system initially it is in first diagram, you can see that is having the high consistency, it is behave like a gel. Now when it is filled inside the syringe, it is converted into the sol, that is solution form. Okay, next it is your, this is while withdrawing the product. Now what will happen, that is the after during the injection. So again, before the injection, inside the syringe your product it is present in the solution form, sol form, that is a low consistency. So that's why it is very easy to inject. If it is a, might be you know, that is if you are taking the some vaccine, the oil based vaccine, if you are taking that, it is quite painful. So viscosity again plays the very important role in case of your that particular while injecting, the age and the age of administration or age of injection. So viscosity, if it is a higher, it may leads to the pain, and if it is a viscosity, if it is a less, it causes the less pain. So during the injection it is present in the sol form. So if you again apply the pressure onto the plunger and if you inject the product, so it goes to the your inside the your skin, and again due to the thixotropic behavior, again it is reverted back to its original state, that is your gel. Okay, now the drug release or the drug diffusion, it is depends on the viscosity. Okay, so if it is a simple solution, drug release or drug diffusion, it is very fast. If it is a semi-solid product or highly viscous product like your ointment, creams and gels, then in that case which is having the higher viscosity, then drug release or drug diffusion, it is very slow. That is the concept of your sustained drug delivery. Okay, so if a product is injected inside the your, when this procaine penicillin is injected inside the your skin intramuscularly, and after that it is reverted back to gel, the consistency it is again increases, and due to the increase in the consistency, again the slow release of the procaine penicillin it will occur, and that without incorporation of your any ingredient, without modification of your formulation, we can achieve the sustained drug delivery. This is the second application of your thixotropy. So after the injection, it is converted to again to this gel form, results in sustained type of your drug delivery. So after injection, high consistency. So this is your second application and very important application. Now some characteristic the rheograms you are obtaining. So first it is your bulges. So some complex hysteresis loops observed when the dispersion system sheared in the viscometer, in which the rate of shear increase and decrease, and resultant shearing stress is measured at the each point. Okay, so the example of the bulges, it is your a concentration of your bentonite gel 10 to 15% weight by volume produces the hysteresis loop with the characteristic bulge in the upward curve. So you just remember the example of the bulges, that is concentration 10 to 15% of your bentonite gel. Okay, so up curve, in up curve, see the diagram, that is as you increase the rate of shear. Okay, rate of shear, then in that case the upward, in the upward curve you can see the slight expansion in the curve, it is there. Afterwards again there is a slight contraction, and finally it reaches to the equilibrium. And after that, if you decrease the rate of shear in the same order, in the downward curve it is completely a straight line, means there is no expansion or a slight contraction in the this particular curve. What exactly it indicates, that is the why it is called as the bulge, because when there is any expansion in the up curve or downward curve, then that particular system it is said to be exhibit the bulge property. Okay, so at the rest the bentonite crystalline plates are, what is the mechanism for this, that is at the rest the bentonite crystalline plates are irregularly arranged. See the diagram, that is the crystalline plates are irregularly arranged. Okay, so this is your first state. what will happen, that is on shear, the crystalline plates of the bentonite forms a house of card like structure that causes the swelling of the magmas. Okay, so upon shearing, that is the crystalline plates are arranged to form the house of cards structure. Okay, and such kind of your system, the expansion of the system it will occur, and such kind of your system, again due to that the you can say it is inside the rheogram you can see such kind of your expansion. This is due to the expansion of the magma. So this is the all about the bulges. Next it is your spurs. The highly concentrated suspension like your broken penicillin develops the rheogram, wherein the bulged curve may actually develops into the spur like protrusion. Okay, so spur like means it is a needle like or sharp, you can say the point is there, so it is called as a spur. The structural breakdown, it is indicated by the spur value y. See the diagram, that is initially rate of shear. If you increase the rate of shear, then rate of shear it is proportionally shearing stress, it is suddenly it is increases, it offers the more, you can say it is a resistance up to point y, and once the point y it will reach, then eventually your system, you can say that is a rate of shear, it is suddenly it is increases. Okay, so this sharp point it is called as the spur, or it is called as the, you can say the spur, it is called as a spur. So application, it is your sustain, it is used for the sustained release on the injection. Okay, for in my already we discussed this example of your broken penicillin. So how much force it is required to break the contact, okay, contact between the particle, and that's why this is the you can get from this particular y value. Okay, so that much shearing stress you have to require to break the contact between the particles, and again it can be easily injectable. This is your second, what do you mean by spur. Next point, it is a negative thixotropy, or it is also called as the antithixotropy. So as the name implies, that is negative or anti means it is exactly opposite to the thixotropy. So thixotropy, it is your the state, it is your at the rest it is your gel, at the equilibrium it is your sole, and at the again after kept aside, again it is revert back to gel. So gel, sole, gel, it is your thixotropy. So negative thixotropy, it will be obviously will be exactly opposite. So it is your at the rest it will be sole, at the equilibrium instead of your sole it will be gel, and when it is kept aside upon shearing, again it will revert back to its original state, that is your sole. Now let us discuss the examples and mechanism. So antithixotropy or negative thixotropy means increase in consistency on down curve on shearing. So in case of your thixotropy, the consistency on the down curve it is a decreases, but in this case, that is a negative thixotropy, the consistency on the downward curve it is increases. Example, it is your magnesia magma, or it is also called as the milk of magnesia. Remember the example from competitive exam point of view. So magnesia magma exhibits an enhanced resistance to flow. What is that is the resistance goes on increasing. What are the characteristics of this rheogram that we are going to discuss? The resistance goes on increasing compared to the previous down curve. So the curve shifted to the right. So as you goes on shearing this material through increasing and decreasing rate of shear, the consistency it will goes on increasing. That's why you can see that is your four curves it is there, that is A, B, C, D. So the curve it is always shifted towards the right hand side. Okay, so consistency goes on increasing. When magnesia magma alternatively sheared with increasing and decreasing rate of shear, the magma thickens. Okay, so viscosity it will be increases. The extent to which the thickness increases reduces on subsequent cycle and finally reaches equilibrium state. Now what is the importance of this particular sentence? Now see the first rheogram, that is your first curve, that is A, the up curve and the downward curve. Now the area within this particular up curve and down curve, you can just observe that is it is quite high. Okay, now see the second, that is after again downward curve of your A, again decreases to suppose say approximately around 100, again increase the rate of shear up to point B, and again it is decrease. Okay, so when you decrease it, now compare the area under the hysteresis slope for A and your B. So area under the hysteresis slope it is decreases. Okay, similarly again at suppose say around 150, again increase the rate of shear up to point C and again decrease. Now compare all the three areas A, B and C. So area under the hysteresis loop goes on decreasing. So what is the significance, or what is your conclusion from this particular why your if the area under the hysteresis loop it is a decreases, then what will happen? So the material, the consistency of your material, it is goes on increasing, the viscosity of your material goes on increasing, but the extent to which this viscosity it is increases, it is goes on decreasing. What is the meaning of this? That is, suppose say at the point rheogram A, the change in the viscosity it is from 100 to 200 centipoise. Okay, so change in the viscosity it is by suppose say 100 centipoise. In second cycle, suppose say at the in rheogram B, the viscosity it is changed from 200 to 260 centipoise. So change in the viscosity it is how much? It is your 60 centipoise. So in A it is 100, in second it is your 60. In third rheogram, if you see at point C, in that case again the viscosity suppose it is increased from 260 to 300. Now the difference between these two it is 40 centipoise. So at first it is your 100, at point A it is your 100, at point B it is your 60, and at point C it is how much? 40. So the viscosity, although it is increases from 100 to 300, but the extent in first it is directly shifted from 100 to 200. So change in the viscosity it is by 100 centipoise. In second again it is increases from 200 to 260, but the extent to which it is increases, it is reduces from 100 to only 60. And finally again from in third point, that is a C, 260 to 300. Again the viscosity again it is increases, but the extent to which viscosity it is the viscosity it is increases, this intensity it is decreases. Okay, so and finally it reaches to the equilibrium. So you can see that is at point D, the up curve and downward curve it is exactly superimposed over each other, so it is identical. So there is no further increase or decrease in the viscosity. At equilibrium there is no change in the consistency on further cycles. What is the mechanism? That is your when system it is at the rest, it consists of the large number of individual particles and small floccules. Now at the sole state, that is large number of individual particles and small floccules. You can see here there is a individual particles, many individual particles are there, and the floccules are few floccules are there, and these floccules also it is small in size. So what will happen? When sheared, the polymer molecules collisions increases, and as a result the interparticular bonding increases. So upon shearing, due to the collision between the particles, the aggregation between the particle it will be increases, and this individual particle or small floccules gets aggregated, and that they are converted into the large floccules. So the size of the floccules it is increases, but the number of, you can see that is a number of your particles it is decreases. Okay, so at this stage large floccules in small number are present. Okay, so size it is increases, but number of number of particles or number of flocculated it is decreases. So the first state, the particles when it is a individual small floccules are there, so such kind of a structure it offers comparatively, it offers the less resistance. But the large floccules are there, so these large floccules obviously they will exhibit the more resistance to flow. That's why it is a gel like large floccules in small number, so they will exhibit the more resistance to flow, so viscosity it is increases. And finally again, when allowed to rest, the bonds broken and individual molecules will present. Again when it is allowed to rest, again the contact between the particles it will break, again particles get separated as an individual particle or small floccules, again it is behave like a sole, so consistency again it is decreases. Okay, so this is the first mechanism, that is why your viscosity goes on increasing, that is from sole to gel conversion. Now comparison between the thixotropy and negative thixotropy. You can see here the graph between the plot between the viscosity and stress over the time. So as the stress goes on increasing over the time, the thixotropy graph, you can see the curve it is decreases. So thixotropy it will be decreases, while the antithixotropy or negative thixotropy, you can see here as the stress over the time it is increases, the negative thixotropy or antithixotropy, the viscosity it is increases. comparison between these two. So first it is your regarding the transition. So in case of your transition, remember gel, sol, gel in case of your thixotropy. Well, in case of your negative thixotropy, it is your sol, gel, sol. Okay, second it is regarding the equilibrium. So at the equilibrium state, it is your sol. Okay, so having the low consistency. While in case of your negative thixotropy, the equilibrium state, it is a gel like or it is a sol like with readily pourable. So it is a having the higher consistency, but still it is pourable. Okay, why you are discussing this, that we are going to discuss in the Rheopecty to differentiate between the negative thixotropy and your Rheopexy, because it is quite confusing. Okay, so equilibrium state in this negative thixotropy, it is a gel like or sol like, but still it is readily pourable. Third, in case of your thixotropy, viscosity decreases with increase in the shearing stress over the time. So in this case, viscosity it is decreases. While in case of your negative thixotropy, viscosity increases with increase in shearing stress over the time. Okay, so negative thixotropy or antithixotropy, viscosity it is increases. Fourth, that is a down curve, it is shifted towards the left of the up curve. So your downward curve, it is shifted towards the left hand side, while in case of your negative thixotropy, this down curve, it is shifted towards the right of the up curve. And finally it is your examples. Examples of thixotropy are shear thinning system, that is a pseudoplastic system, or pseudoplastic system like your polymers like sodium alginate, milk, then second is your sodium carboxymethyl cellulose, then tragacanth, acacia, HPMC, then your methyl cellulose. Whatever the polymers are there, all these polymers are generally exhibit the thixotropic behavior. And in case of your negative thixotropy, the examples are magnesia magma. The concentration, it is generally 1 to 10% divided by volume, and flocculated suspension. Again, remember the concentration and the type of suspension, that is a flocculated suspension. It is important while comparing the negative thixotropy and your dilatancy. Now next is your negative thixotropy versus your dilatancy. Okay, so in your previous lecture we discussed regarding the dilatancy. So dilatancy, again dilatant flow, again it is also called as a shear thinning system, means upon shearing the viscosity goes on increasing. Again, in case of your negative thixotropy, upon shearing the viscosity goes on increasing. Now what is the difference between these two? Okay, so the graph that is shown, that is in both stress over the time, both for dilatancy and negative thixotropy, the viscosity goes on increasing. The difference it is given. First, again, in case of your transition, negative thixotropy, sol, gel, sol, and in case of your dilatancy, it is from sol to gel. Again, at the equilibrium state, it is a gel-like or sol-like, still it is pourable. Okay, so although it is having the at the equilibrium state, it is converted from sol state to the gel state. The consistency it is increases, but still the material it is pourable. And in case of your dilatancy, the equilibrium state, it is a completely a gel. Okay, so it is a highly, you can say it is a viscous material it is there in case of your dilatancy. And the major differentiation between the negative thixotropy and dilatancy, it is totally based on the examples. Okay, so the examples are for a negative thixotropy, it is a magnesia magma. So concentration it is 1 to 10% divided by volume, and your flocculated suspension. While in case of your dilatancy system, that is the examples are deflocculated suspension. Okay, and the concentration it is generally more than 50% weight by volume. So remember this, that is for negative thixotropy, it is your flocculated suspension, while in case of your dilatancy, it is your deflocculated suspension. And the second, it is your concentration. Negative thixotropy, generally the concentration it is very less, that is 1 to 10%, while in case of your dilatancy, the concentration it is quite higher, that is more than 50%. And last point, that is your Rheopexy or Rheopecty. That is your Rheopexy is the phenomena in which the solid forms a gel more readily when gently shaken or otherwise sheared than when allowed to form the gel while the material is kept at the rest. Okay, so Rheopexy, it is simply it is conversion of your solids into the gel. Okay, so viscosity, you can say it is goes on increasing. In the Rheopectic system, the gel is the equilibrium form. Okay, examples are, that is as such Rheopexy or Rheopectic material, very rare examples are there, but one combination of magnesia magma and the clay suspension, they might show the Rheopectic behavior. Okay, So but very little information it is available regarding this magnesia, magma and clay. It is more Rheopexy and Rheopecty. It is more important in case of your mechanical engineering. Okay, so rheopectic fluids such as your lubricant, few lubricants upon shearing, it is converted from solid form into the gel-like structure. Okay, so these materials are referred as the having the rheopectic behavior. Now comparison. Negative thixotropy and the rheopexy, again in both the cases the viscosity it is goes on increasing. Then what is the difference? First, again in case of your negative thixotropy, transition it is sol gel sol, and in case of your rheopexy, transition it is your initially it is a solid and afterwards it becomes gel. Okay, so in case of your negative thixotropy, second it is your equilibrium state is sol like or gel like compared to the rheopexy. Okay, so when you compare the viscosity between the negative thixotropy and the rheopexy at the equilibrium, although the states are gel, but comparatively the consistency in the negative thixotropy it is very it is less. Okay, so that's why it is called as a sol like, or generally it is compared to the rheopexy it is referred as the sol. Okay, while in case of your rheopexy, the equilibrium state it is your completely a gel, highly viscous, highly consistent equilibrium state. Okay, so it is generally not moving or not flowable. Okay, so this is the difference. Might be you get confused between the, although the negative thixotropy, the equilibrium state it is also referred as a gel, also it is referred in rheopexy, also it is a gel. Then what is the difference? Okay, so gels, again few gels are easily flowable, few gels are quite, you can say that is a quite difficult to flow. So likewise you can take the example, that is a rheopexy. It is a substance substance in which the gel it is generally very difficult to flow. Okay, having the very high consistency. In case of a negative thixotropy, also it is a gel but with the less consistency. Okay, so likewise you have to remember. And finally it is your examples. The examples of negative thixotropy, it is your magnesia magma, concentration it is 1 to 10% weight by volume and flocculated suspension. While in case of your rheopexy, examples are lubricants, magnesia magma and clay suspension. Okay, hope this will clear you all the concept regarding the thixotropy, the definition, the meaning, then mechanism, then your measurement of the thixotropy, then your next is your what do you mean by bulge, what do you mean by spur, then next it is your what do you mean by antithixotropy or negative thixotropy, and lastly it is your rheopexy. Okay, so very little information it is available regarding the rheopexy, so I tried to cover it from the book Martin, and whatever the information it is given in the Martin, and from few information it is taken from the standard reputed journals, and I tried to cover it. Okay, so hope you it will clear all your concept. Still, if you have any doubt regarding the negative thixotropy, rheopexy or thixotropy mechanism or measurement, you can comment in this below this video. Okay, so in next lecture we are going to discuss that is a fourth lecture on your rheology chapter. In that we are going to discuss regarding the viscometers. Okay, different types of your viscometers that we are going to discuss. Thanks for watching this video. Please like and subscribe my channel if you like this video, and if you want to hear more videos regarding the rheology and regarding the pharmaceutics, then please like and subscribe this channel for more related videos. Thank you.